I want to take a second to review the inhibitors of protein synthesis. I can't overemphasize the importance of these and remembering which inhibitors inhibit which subunit and at which point the translation machinery itself is inhibited. So we're going to look at them again individually. What are the two classes of antibiotics that bind to and inhibit the 30S ribosomal subunit? It's the aminoglycosides and the tetracyclines. Okay, the aminoglycosides, they function by inhibiting translation initiation. They bind and prevent the whole process from really occurring. How does tetracycline work? It works by binding to the small ribosomal subunit and blocking that A site from having an amino acyl tRNA coming in. So it blocks elongation. That's how tetracycline works. It binds to the A site and it prevents elongation. What are the inhibitors that bind to the large 50S ribosomal subunit? It's the macrolides and it's chloramphenicol. And how do they function? The chloramphenicol is going to function by binding to and inhibiting peptidyl transferase. When it binds to the large ribosomal subunit, it inhibits peptidyl transferase. Erythromycin is going to function by binding to the large ribosomal subunit and inhibiting elongation. It inhibits elongation of the growing protein. Now, a couple of toxicities. We already spoke about the ototoxicity, the nephrotoxicity with aminoglycosides. We talked about tetracycline. Of course, this can cause a rash and so forth, things like that. You would never want to use tetracycline in young children because it could be toxic, of course. Chloramphenicol has special toxicities associated with it. And there's two. There's two that you need to know. What are they? Well, it's aplastic anemia, which would be basically a pancytopenia, and gray baby syndrome. Let's look. So the chloramphenicol toxicity is going to be aplastic anemia and, of course, gray baby syndrome. If the baby, in some third world countries, chloramphenicol may still be used. Chloramphenicol is very potent in treating bacterial meningitis, among other infections. And unfortunately, sometimes it can be toxic. Babies can get this gray color due to mitochondrial toxicity. They can get aplastic anemia irreversibly, and this can cause a lot of problems. So be prepared for that toxicity if you're asked about it on the board exam.